Our next speaker this morning is Denise Millstine. Dr. Millstine is a member of our Division of Integrative Medicine, an expert in the field of all the additional therapies. Some people call it naturopathic, other people give it various names, but truly we don't look at the different ways of treating patients as being separate buckets. It is all about health and wellness and doing whatever helps you live your best possible life. And Dr. Millstine is truly a leader in this field. So, Denise, please.
Well, good morning. It's just amazing to see all of you braved the cold weather this morning and any snow or rain that we still had. I think we've gone a little bit out of order, which is fine. I'm resilient and we can roll with that. That's fine. If I can just have my slides, I think Bruce is working on that. And, I was a little bit nervous this morning because it's difficult to come on stage following Derek Hall and then Dr. Cron, who's an amazing speaker. So maybe I lucked out that I only have to follow Derek Hall, although of course he's a tough act. I'll just start by talking about what integrative medicine is. So integrative medicine is an approach to health and healing regardless of your burden of disease. In a moment, I'll show you that the three shields of Mayo Clinic, which are, of course, patient care, research, and clinical practice, research, and education in our integrative medicine branding have been changed to three leaves to give you the more natural feel of what it is that we bring to your journey, all that you're dealing with. So, in integrative medicine, we manage a number of modalities that are a bit different than what you might discuss when you come to see Dr. Bryce or Dr. Sekulic or one of the other physicians who you'll hear from later today. We talk about mind-body practices as well as many other natural healing practices, including other forms of medicine such as traditional Chinese medicine, and then using your diet, your exercise, how you move your body, and also natural products, which many of you I'm sure will have many questions about. I'm still waiting for those slides, so I'm just going to keep going. Well, let me start with this. I'm going to ask you, is it possible to be healthy when you have cancer? I think we've just seen two remarkable examples of that in Derek and Mrs. Hall in terms of how healthy you can be regardless of your burden of disease. I'd have you think about somebody in your life maybe who has even an advanced cancer or a difficult to treat cancer, and you see them kind of glowing and thriving and living their life and making the most out of every day. And you could probably think of somebody else in your life who maybe doesn't have a high disease burden, who kind of has that like gray appearance, they kind of trudge through life and they're not healthy. So in integrative medicine, we think health isn't necessarily what your disease state is, that we can achieve health regardless of the burden of disease that you're living with. So this is me. And these are the three leaves I mentioned instead of the three shields. The several domains of integrative medicine that the National Institute of Health has put forward, and I've mentioned those to you as well. I'll comment on how many people with cancer are actually using integrative medicine, or what was formerly called complementary and alternative medicine. So you see in that first line, the range is broad, and that really depends on what you're including in the umbrella of integrative medicine. But you have up to 95% of patients who've been diagnosed with cancer participating in what some people or some researchers would actually include integrative medicine. I think that next set of information is more impressive to me. So up to 3/4 of people who've been diagnosed with cancer don't discuss their use of integrative medicine with their cancer. And what they've reported, the reason for that being is that their providers just didn't ask them, or they came in thinking that if they told their doctors they were using these natural therapies, there would be some disapproval or disinterest. Or they thought their physicians or providers weren't able to advise them on the use or not using. Or they thought, it doesn't matter, it's natural, it's not gonna hurt me, it's not gonna interfere with my treatment. But I want you to get that final point, especially, that for those who did discuss their use of integrative medicine with their providers, they had a higher satisfaction with their care, and that there are people like me and my team who work to help guide you if your providers don't feel like they have the background to advise you. We asked groups similar to you several years back whether they were using integrative medicine or not, and you could see that more than half of you, or people like you, were using nutrition, meditation, their movement or exercise, and natural products in about a third of people. So when I say that we're not talking about integrative medicine, to me, it means we're just missing the boat. We need to be having these conversations. Interesting that Dr. Cron provided us with the garden analogy. So this is the analogy I like to use, and this was given to me by a really wise physician, Dr. Gladys McGarry, that I think of people as if they're a tree with a very intricate root system, that their cancer is like a boulder in that root system, and that most of the people you come across in your cancer treatment are focused on the boulder. Can we cut it out? Can we poison it? Can we zap it with x-rays? What can we do to get that out of your body, or at least contain it? I like to think of the tree and the soil. So while all these really brilliant people are focused on that fight, which is so necessary, what can we do to keep the rest of that soil healthy so that your tree can continue to thrive? There is a Society of Integrative Oncology, also called SIO, that puts out guidelines to using and incorporating integrative medicine in the care of cancer. And much of my talk is going to be based on their guidelines and the level of evidence that they provide for us using these strategies in care. Sorry, this is a little twitchy. Let me use the keyboard. Okay, so I'm introduce you to a patient who I met earlier this year. His name was Carlos, 62 years old. He'd been diagnosed with prostate cancer a couple of years ago. He'd gone through chemotherapy. At the time that I met him, he was doing radiation and taking oral medications. He really struggled with neuropathy from his chemotherapy, and he felt tired. He just couldn't get done the things that he wanted to get done, and he was pretty anxious about his cancer burden and what was going to happen in the future. He and his wife had made a New Year's resolution to go low carb, and they took the sugar out of their diet, and this was the end of January, and they were still doing it, which I thought was pretty impressive and wonderful. He didn't sleep so well because of his treatment and his condition. He was up several times per night, and he just felt basically exhausted. He kept himself busy kind of puttering around the yard, but he didn't want to go and ride his bike, which he used to like to do. Because of the neuropathy, he was afraid he was going to get injured. His stress was pretty high. He loved this job that he had when he was initially diagnosed, and he just recently had to leave it because of his energy issues, so he didn't have that supportive community around him anymore, and he was taking a number of supplements. We'll come back to Carlos. So let me start with this SIO guidelines. And if you kind of drift off during my talk, this is the one slide I want you to pay attention to, the next three, okay? So exercise, this seems like a very obvious statement, but let me just read it anyways. Regular physical activity can have a positive role in cancer. You can insert any condition in there, right? In heart disease, in diabetes, right? Regular physical activity is good for you in many, many ways. But it is incredibly impressive what happens in cancer care when you move your body compared to when you don't. If you move regularly, you improve your chance of survival. You decrease your chance of cancer recurrence. The study I'm showing you here, and it is by far not the only one, was in about 3,000 people in a multitude of cancers. These people were exercising only 1 day per week, and they showed a 33% survival advantage. This is a big outcome. Another study of 4,000 people showed that when patients exercised or subjects exercised, they had improved quality of life, emotional well-being, fatigue, pain, and anxiety. And I chose this picture at the bottom because I want to remind you that whatever type of exercise you like to do, you will continue to do. So you can walk, you can bike, you can hike, well, maybe not in the rain and snow this week, but in general, we live in a great place for all of these outdoor activities, or you can go to the gym or hit the treadmill if that's what you really like to do. What I summarize for people is that 2 hours of exercise, moderate intensity exercise, provides this survival benefit. 2 hours per week of moderate intensity exercise. And intentionally, you need to remember moderate intensity exercise is not the same as it was when you were 20, if you're 50, if you're 70, or if you've just gone through cancer treatment. So it's moderate intensity for you, not for your neighbor or your spouse or whoever it is that you're exercising next to. Just a comment quickly on some specific types of exercise. So we encourage yoga often for cancer-related fatigue. It does lead to better sleep, improved quality of life and stress, and also improved sexual dysfunction, important in many, many types of cancer and after their care. Resistance training, which could be anything from Pilates to bar work to body weight, things you can just do at home, squats and lunges, etc., has been shown to reduce those muscle aches that come in women who are treated with endocrine therapy after a diagnosis of breast cancer, and also helps you to maintain your physical fitness level. We encourage people to exercise early in their diagnosis, in their course. So for Carlos, let's get back to exercising regularly. With the neuropathy, let's stop pounding on those feet. We're gonna put him in the pool. We're maybe gonna get him into an exercise class because he's missing that idea of community that he was getting from work and is no longer getting. Or he can just go out for a walk with his wife. She was into that. All right, you're gonna have a whole talk about nutrition, so this will be speedy, but I can't give a talk about integrative medicine and cancer and not talk about nutrition. So here is what the World Cancer Research Fund has put out in terms of recommendations for healthy nutrition for the prevention or reduction of burden of cancer. Be lean but not underweight. Avoid sugary drinks. I'm going to modify that to just say avoid added sugar. Limit your consumption of energy-dense foods. Eat a lot of vegetables, fruits, whole grains, and by the way, whole grains are the grains you can actually see, not the whole grains that they then pulverized into flour and put into Fruit Loops. It says it on the front of the package. In case you don't believe me, check next time. And then beans or legumes. Limit your consumption of red meat. Red meat is any meat that comes from an animal, comes from a mammal, especially if it's been processed. And then limit salty and processed foods. Oh, great, that was brilliant, right? Eat less and exercise more. That's the most ridiculous fad diet I've ever heard. But let me tell you, there was actually a study that came out that showed how effective this is. So using those very simple diet recommendations that I just showed to you, they looked over a course of many patients, over many studies, to show if they adhered to that high adherence versus low adherence, what happened, and they dropped their incidence of cancer by 10 to 61%. Huge drop in cancer rates for very simple, easy to accomplish diet recommendations. And I think it's so important to have resources. It's fine for me to say, oh, just cook healthy food. But I like to give people these two cookbooks when they come to see me. The one on the left, Cook for Your Life, is written by a breast cancer survivor. And her intention in writing that cookbook is that you would prepare that food for yourself, or it would be simple enough to hand the recipe to a friend who says, hey, is there anything I can do? Whip it out of your purse and say, yes, you can make this for me. I would love that, instead of them cooking you, some of those unhealthy foods, that comfort food that we tend to want to bring to people when they're going through something like this. And The Cancer Fighting Kitchen is just a beautiful book by Rebecca Katz, but it's really geared towards people who like to cook and who don't mind finding unusual ingredients. I am selfishly putting this up because in conjunction with another integrative medicine provider and a medical oncologist at Mayo, we put together a pamphlet on healthy nutrition and cancer. So for those of you who are treated at Mayo, this is easily available to you as well. All right, back to Carlos. Keep going with that New Year's resolution. Keep eating real food. Limit your added sugar. Talking about body-based therapies. So massage can reduce anxiety and pain, but important to use an oncology-trained provider if you've had manipulation of your tissue, so particularly if you've had surgery and or radiation. So even in patients with advanced cancer, massage is very helpful. 6 30-minute massages over 2 weeks, so basically every other day, reduce pain and improved mood in patients who had advanced cancer. And in patients who live with metastatic bone pain, they also showed that massage has improved pain, enhanced relaxation, and also enhanced that ability to sleep, which is really critical. Massage reduces pain compared to no treatment and compared to conventional care. This is important in this era where we worry about controlled substances and our opiate crisis that we currently have in this country. So it's something I want you to put in your mind as a therapy, not necessarily something you do on vacation as a treat to yourself. Especially if you have surgery-related pain, massage can be helpful. And I put this image on here to remind you that reflexology, which is putting pressure on certain points, typically on the foot, sometimes on the hand, sometimes on the ear, is very effective in managing pain as well. And the reason I say this is that you can do reflexology very easily. So you don't need to disrobe. You don't necessarily even need to be in a very private setting. And it's typically very inexpensive. And unfortunately, massage doesn't tend to be well covered by our insurances. We also use a lot of acupuncture in cancer care. So this is a component of traditional Chinese medicine, the philosophy of which is the movement of your vital energy, which is termed qi in their philosophy. We know acupuncture reduces pain, so particularly things like headache, chronic pain, back pain, we use this all the time, but also for nausea and vomiting and for fatigue. And even though we're sticking these hair thin, so one of these needles is the size of a piece of your hair into the body, it's a very, very low risk intervention that's accessible, and I'll just mention because I said it about massage, typically well covered by insurance, except Medicare, unfortunately. So I had mentioned that Carlos has neuropathic pain from his chemotherapy, and I'll mention about auricular acupuncture, which is acupuncture done on the ear. Another form I like to just bring to mind, because again, this can be done in a public setting. It's typically very inexpensive in a group setting. We use acupuncture also for those of you who are living with head and neck cancer, for the dryness of the mouth that comes if you've had radiation to the top part of your body. Acupressure can be helpful for nausea as well. So I'm showing you that P6 point just below your pinky on that side of your wrist. If you have mild nausea, or if you are going through an experience where you tend to get nauseous and you're starting to feel that kind of queasiness, you could just simply put pressure on this point. They also sell bands that'll put pressure on that, or this is something that somebody who comes to therapy with you could do for you. Electroacupuncture, where you place the needles and you add some stimulation, is also quite effective in reducing vomiting. We use quite a bit of ginger, which is effective for nausea in its dried form. So this would be the spice that you probably all have in your pantries, or in a tea or a crystallized ginger, which is easy to keep on hand. And in addition, we use some hypnotherapy for nausea. Back to Carlos. So we thought we'd try the acupuncture for his neuropathy, his fatigue, and his anxiety, and we talked a bit about massage. So natural products, I could spend the rest of the day talking about natural products, so I'll just try to hit a few highlights for you all. This is what happens when you walk into one of these health food stores. On last check, there were 800,000 products on the market that are labeled as natural products, either botanicals or supplements. It is very difficult to navigate this landscape. So here's how I do it. I think about whether or not this product has scientific evidence that it's going to help you, and whether or not I think it's going to hurt you. So if it's going to help you and it's not going to hurt you, I'm going to say, please take this. If I'm not sure it's going to help you, but I'm pretty sure it's not going to hurt you, I say, if you want to take it, go ahead. If I think it's going to hurt you, I better be convinced that it's going to help you in order to tell you to continue to take it. So just talk about a multivitamin. Many people will take a multivitamin after cancer care, and this is probably a good thing to do, particularly if you have a history of breast cancer. But it's important to review the dosing. If the dosing is 6 tablets a day and you're taking 1, you're probably not adding that benefit that you're looking for. Vitamin A is probably the trickiest part of the multivitamin. So when you're selecting your multivitamin, I want you to look at this line particularly. That preformed vitamin A in supplemental form has been shown in some people to increase rates of cancer and increase rates of death. So I don't like to see a lot of vitamin A in those multivitamin products. Folic acid dosing should be somewhere around 400 micrograms, particularly if you're a woman who's premenopausal. Vitamin E dosing, I think, also needs to be looked at carefully. We don't want those excessive doses there either. Make sure you don't have too much zinc compared to the copper so you don't result in a deficiency. Iron only if you need it. So if you are not losing blood, meaning you're not a menstruating female, then it's good for you probably to take a product that doesn't have iron, which most of the what are now called mature formulas won't have iron in them. Also look for sugars, coloring, preservatives. So if you're taking something that has red number 4 as an ingredient, not a high quality product. If you're taking a gummy, sorry about this, but that's pretty much glorified candy, probably not worth taking unless it's really the only thing that you can get down. And often the botanical additives in multivitamins are not enough to be really effective. There's too many of them at too low of a dose. So it's nice packaging, it's nice marketing for them, but really not enough to say, oh, I'm taking this often in the product. Antioxidants I've started to mention as part of the multivitamin discussion or comments that I made. So antioxidants are safe and beneficial when they're in your food. So there you see pictures of high antioxidant foods. People who are undergoing radiation therapy also often get this message that they shouldn't be having antioxidants. And what we mean by that is we dislike antioxidant supplements at that time of your treatment. That is not the same thing as saying you can't have green tea and blueberries. You absolutely can. So nobody's going to discourage you from having antioxidants in your food, but I would avoid them in supplemental form unless somebody has specifically recommended that to you for a medical condition, because they do have this increased rate of mortality, particularly with high doses of vitamins A, C, E, and selenium. And there's a concern that they're interfering with your treatment. So if you're undergoing radiation, some of the damage to that tissue, most of the damage to that tissue is intentional. So you don't really want those to come into the system and clean up too quickly. You want that treatment to have time to work. Vitamin C is a hot topic. It's a known antioxidant. It's been associated for many years with wound healing, strength of our collagen, metabolism, health of the nervous system. IV therapy is the only way to get high doses of vitamin C. So if you take vitamin C by mouth, your body gets rid of it before it gets to those high doses. And the data for using those super therapeutic doses of vitamin C is really limited. A lot of it is anecdotal and emotional and driven by market and agenda. So there are studies going on now to see if IV vitamin C is really helpful. It often is probably not toxic in the short term, but it's typically very expensive. So I would caution you away from it unless you clearly understand the mechanism of why and why it's important or effective or has been shown to be useful in your personal cancer journey. If you're taking vitamin C orally, and I do recommend that women who are breast cancer survivors take a small dose of vitamin C, about 500 milligrams a day, to decrease their risk of recurrence. Watch for sugar, so your powders, your gummies, many of the vitamin C products come with sugar in them. Try to avoid that. Quick comment on omega-3. So it does in cell data, in scientific cell data, have some anti-tumor effects, and it has been associated with improved quality of life. And interestingly, in people who take omega-3 supplements during cancer care, they often are able to maintain their nutritional status, which is obviously a good goal. There's some animal data that omega-3 may interact with chemotherapy. So if you're taking it while you're taking chemotherapy, please check with your pharmacist about that. And there's also some data that use has been associated with a decreased risk of prostate cancer. And turmeric, may be one of my favorite botanicals, is anti-inflammatory. We use this quite often. When you look at cell data, when they take turmeric and they put it in a lab onto cancer cells, they start to behave like normal cells. We do not know if that happens in the human body, but here we have potential benefit and really low risk with turmeric unless it's interacting with your therapies. So I'll often encourage people to go ahead and take turmeric, 1,500 milligrams a day, paired with black pepper to increase its absorption. And in prostate cancer, there's a proprietary product that's actually been studied and shown to be potentially beneficial. So we'll go back to Carlos. He's going to do a multivitamin. He's going to take turmeric when his radiation is over because, again, it's an antioxidant. And I'm going to encourage omega-3, which he could get from a supplement, or he could eat more fatty fish, kind of up to him and his lifestyle. We have to talk about stress and its role in your body's environment when cancer is developing and when you're undergoing treatment for cancer. So we know that mind-body modalities can improve mood, pain, sleep, and quality of life. Again, those Society of Integrative Oncology guidelines tell us to incorporate this, and that could be anything from meditation, yoga, tai chi, hypnotherapy, music therapy, art, or relaxation with breathing. Really simple breathing practice that I try to do at least 2 times a day that I learned from Dr. Weil, who's had the benefit of studying with. So the 4-7-8 breath, so simple. Inhale for a count of 4, hold for a count of 7, release for a count of 8, 4 times in a row, 2 times a day. Likely to help? Nobody's ever been hurt by breathing, right? So this is a great therapy that is freely available to all. You can do it anywhere. You can do it in your car, you can do it in a meeting, you can do it while you're fighting with your spouse, unless your spouse is here with you today, because then they're going to pick up that that's what you're doing. But it's a great thing to have in your back pocket. We also have the Mayo Clinic Guide to Stress-Free Living, which I could talk to you again all day about, looking at a specific way to approach what's the role of stress in your life. Is it good stress, or is it bad stress, or is it ineffective stress that's just robbing you of your energy and your ability to fully live your life? So going to Carlos, he was really struggling with this component, and we had him come to some of our classes in the Mayo Clinic Guide to Stress-Free Living. So I have the honor to practice at Integrative Medicine at Mayo Clinic here in Arizona. I hope that you all know, if you've been treated at Mayo Clinic, that we offer consults that are holistic. We get 1 to 2 hours with our patients to talk about all these different therapies and how they're incorporated into their care. We offer massage by, of course, oncology-trained providers. We have acupuncture by amazing therapists, and then multiple classes and workshops. All of our classes are scalable, so if you're coming through the cancer building at Mayo Clinic and you think, I can't do yoga because I can't get down on the floor, we will work with you. We are used to that. We have multiple types of yoga, multiple types of tai chi, and meditation 3 times a week. We have a number of workshops, some of which are based on Dr. Sood's work that I've already mentioned to you. Also about writing to heal. A professional writing teacher comes and meets with us once a month to talk about her work and to teach you to use writing in your healing journey. And I'm a reader, so I cannot finish a talk without telling you about at least a handful of books. Much of what I've learned about the cancer journey comes from Anti-Cancer by Dr. Servan Schreiber. This is an amazing book that was written about, over a decade ago. So some of the information is dated, and last year, Dr. Lorenzo Cohen, who practices integrative oncology, put out Anti-Cancer Living as an update of this. Keith Block, who many of you have probably known about, has Life Over Cancer. And then Dr. Nassi, it was new to me this past year, who wrote Cancer as a Wake-Up Call. What can we learn from our cancer journey? What is it that we can do to improve our health, like I started my talk, as we go through this difficult time. Thank you so much for your attention, for putting up with me with my slides. I'll be around for the morning, so please come up with any of your questions.